Good afternoon, everybody. My name is Simone di Vicenz. I work for Christian Aid and Local to Global Protection. I'm sure you're here for the catchy title of my presentation, and you are intrigued. So, this one. I would like to introduce you to Bweremana. It's a tiny village in North Kivu in the DRC, Congo. Christian Aid has been working with the local partner, CBCA, for a resilient program, a community-based DRR program between 2011 and 2016, with the aim of empowering community to collectively address their risks. On the 5th of October in 2014, a massive landslide fell on the north side of the village. It led to 3 people dead, 45 injured, 50 houses destructed, and significant impact on agriculture. The next day, I had on my inbox the needs assessment conducted by the Village Development Committee together with our partner, CBCA, which was quite comprehensive and holistic, was very detailed. At that time, Christian Aid didn't have the funding to respond, so we tried to approach other organizations working in the same area, and we found one that agreed to support the village. So over the next few days, they went directly to the family affected, conducted a needs assessment, and after 15 days, they came back and delivered the assessment. I asked after some time for the evaluation of that response, and I noticed that the needs assessment that they conducted was very different from the one done by the community members. It was basically WASH and agricultural input. Of course, the evaluation was showing also that the response was quite successful. They meet the needs. And these pictures, they're blurred because they were coming from the needs assessment done by the community members. You know? And I think when we start thinking about localization, we need to also adapt ourselves to lower quality of information. So, of course, the villagers were grateful for the response. However, they felt a bit betrayed. For me, it was a kind of a missed opportunity because everything was set to help them properly. But this example really highlights the disjunction that still exists between DRR intervention, which are more looking at increasing the agency of people, and humanitarian intervention, which are externally led, narrow, and focused on meeting basic needs. So today, I will keep this case study in mind, and today I would like to take you to a small learning journey that Christian Aid conducted together with Local to Global Protection. Local to Global Protection is a kind of entity, a laboratory, who has been capturing the lesson of self-help initiatives across the world in the last 10 years. So when the disaster strikes and aid is not around, what happens? They identify that people rely more amongst themselves. There are some groups that work together. However, they lack resources. They give a lot of importance to social, cultural, and dignity element, the psychosocial aspect. They focus quite immediately to livelihood recovery because they want to get back on their feet. However, knowledge and information is not evenly distributed, as well as power and capacity, which sometimes leads to complex exclusion-inclusion dynamics. They also try to ask, what do you think, you community, of humanitarian intervention, the classic humanitarian intervention? Of course, appreciation, first of all. However, there's a bit of frustration because they're slow, they don't build on local capacity, they often leave too quickly, and often they're divisive, create dependency, and over time they can reinforce unhelpful power dynamics. If you look at the holistic well-being, I don't know if you're familiar with this flower, basically classic humanitarian intervention look mainly at the biological and the material aspect of well-being, sometimes mental, almost only in conflict setting, while DRR approaches try to integrate all the bits. How it has been well put by one stakeholder, community members are not like ghosts. They need more than food and water to survive. So there is something that is not working somewhere. So with this in mind, we partnered with King's College London to try to understand how we can, how can humanitarian response strengthen community resilience. And it was part of a consortium project funded by DFID called Linking Preparedness, Response and Resilience. And first thing that I did was a literature review, a thorough one. And what I found, there were two significant gaps. The first one was that as a humanitarian actor, we never ask survivors how we should be working, as in the case of Guatemala. The second one was a lack of systematic review. We always do it internally, but not as a sector. And the resilience lens that they used were useful in focusing a bit more on the local capacities, and as well as looking at the window of opportunity for transformation that disaster allows, that often we never take. This was the research question. They conducted 8 case studies across different geographical distribution, different type of hazards, including conflict, and different working modalities. Some were direct implementation, partnership-based, faith-based. First of all, what was identified? The perception of resilience. So, resilience is, for survivors, being independent and looking for support when needed. Or again, has been well put, resilience means having the skills and capacity to look after yourself whilst knowing how and where to ask for support when needed. And this is the main finding of the research. This will allow humanitarian responses to link to long-term resilience. This is from the community perspective and systematic review. The first one, they ask to run the response. Community members want to run the response. The second one is to coordinate with the government, coordinate intervention and with the government, even in conflict setting. Support community cohesion and effective two-way communication, addressing the underlying causes, trying to use that window of opportunity, include psychosocial support, because in any type of crisis people are stressed, not only in conflict, and livelihood saving from day zero. With this in mind, we partner with Local to Global Protection again, and with their network of partners, we co-design an approach that we're trying to transform the 6 recommendations into a practical approach. And across different geographical areas, they came out with something similar. And in all of the cases, they put community well-being as a cohesive, organized, resilient as the outcome of the humanitarian response, which is quite different from our normal classic definition and name of the humanitarian response. They identified 8 blocks to achieve this. The first one is called PALC, is using volunteers across the villages to be the eyes, ears, and voice of the villages. The second one is the utilization of a microgrant in emergency, so distributing microgrants to self-help groups to address their needs identified by themselves. The third one is looking at skills upgrade, demand-led for these groups. Conflict sensitivity, in order to avoid tension and power dynamics. Creating an alliance, this horizontal communication, and try to link different groups, as well as coordinating with the classic UN system, so the informal bit and the formal one, as well as going into the space and advocate for change. And as well as the big message from their side was that you need to change the institutional architecture. The Grand Bargain did a great step in pushing to localization. We field tested it, and the type of intervention that came out were mostly livelihood, then access to services. Just a tiny minority were pure relief. And even peace-building activity were there. They were free to do whatever they thought was important to them. I would like to show you now a small video developed by Local to Global Protection.
If you give a stick to someone, it means you have been given power. Empowering means let them make decisions. Empowerment means giving them resources. Why do we hold on to the power? Release it. Let them use it.
Over several years, survivor and community-led crisis response has emerged as an attempt to address a significant gap in humanitarian practice. The inability of most external aid to support self-help efforts by groups of crisis-affected people.
This is about how we unlearn the things we've been doing up to date and start participating in the existing ongoing humanitarian response that communities in crisis do without us.
Yeah, I think community-led response is really about empowering people to address the identified needs that by themselves, but at the same time ensuring that it empowers them to address not only the immediate need, but also the root causes of the problem.
If everything happened to one person, so they all gather and discuss what do we know we do without even seeing who has what, without saying we don't have, but just see what we can do.
They have a lot to offer, especially these small groups, which people feel that, they are just there for themselves, but sometimes they are the ones who come on board and rescue the entire village. If you give a stick to someone, it means...
Thank you. This was just a snapshot of a 9-minute video that I really encourage you to watch it. It gives a bit more of detail, a bit of what I commented, but also a bit more detail on the mechanism of how it works. So basically the message we are trying to deliver is that both the academia research, so robust evidence, as well as the practical implementation, show that there's quite a lot going on during a disaster, and we should be better in trying to plug and participate in the initiative of community instead of making them participate in our own work. And it is possible to link humanitarian response to resilience, applying the 6 principles. The Grand Bargain offers a great opportunity, especially through the localization agenda, to push more decision-making down to national actors. However, practice and theory and practice have shown that actually we need to push it even further to community level to make them real agents of change on their own initiative. For a bit more information on what I've discussed, you can visit the website Local to Global Protection. And I will thank you very much, and we still have 2 minutes, so if there's any question, I'm happy to take them. If not, I'm happy to run away. No. Chris.
So thank you very much for the presentation. So what we kind of understood from that is it's very much about having communities becoming part of that action and agent of change. But what's stopping that from happening? What are the barriers or the ways to move this forward and to have this an approach which is adopted by maybe more humanitarian actors or more local government structures and systems?
Thank you very much. Well, there are different factors. Currently, the idea of community-led response, ours is not the only one. There's a lot of different ways of approaching it. There's a lot of, in the wider sector, there's a lot of experiences that are finally becoming visible because these were already present. So on one side, it's just providing a bit more evidence that is working. There's still a bit of skepticism that this can work at scale. In our case, we did quite a lot of pilots, but they're still quite small. We need to show that in a fast onset, this is possible and absorb quite a huge amount of money. So we're keep on working with King's College to try to find the solid evidence. And that's one bit. The second one, I think, how our colleagues from the National NGO correctly identified, the architecture is still quite rigid and top-down. And the whole discussion around the localization agenda and how it's so slowly progressing is an evidence on that. And with community-led response, we are pushing even further down the power. So it will take quite some time. So funding are not, the funding models are not good because they're very rigid. They're based on needs assessment. In this case, you don't have a needs assessment. The needs assessment is done by the self-help group micro projects. So it's a different way of working. The third element that I would like to flag, it's a bit of a culture. It's going back to the case of Gueremana. It was an attitude of going in and running their own response. So there is also a need of change mentality, mindset, and that probably will take even, I think it's probably the hardest one to change at the moment.
Thank you. Thank you for the really interesting presentation. I have a really quick question. Full support of the crisis-led response and the community-led resilience. What would be your one recommendation for UNDRR and fellow INGOs to take this forward? Kind of one takeaway thing.
I think that the easiest way is to try to embed this type of approaches in our community-based DRR programs, and that's the easiest way. So, and having a commitment to, when a disaster happens, to use it. So, closing the community-based DRR cycle totally within the community. That's an easy win, in my opinion. Thank you.